Hello and welcome once again to another episode in the series Learning Disabilities, and today in this video I am going to talk about dyspraxia. Dyspraxia, as I already told in my previous video, that it is a disorder which affects actions. It is basically a neurological disorder which affects the coordination between the brain and the body. The messages the brain sends to the body is not received by the muscles properly, and thus a person fails in bringing out proper actions. It is also known as developmental coordination disorder. So it affects fine motor and gross motor skills severely. If a child is diagnosed with dyspraxia, if a person is suffering from dyspraxia, he needs treatment for sure, and there is no cure. There is always a need of therapists who work in collaboration as a team so that a child can live a better life. And if the problem is diagnosed early, it is identified during the early childhood, then a child can lead a near to normal life. For treating dyspraxia, occupational therapy is the primary treatment. An occupational therapy works hard to improve the gross motor and fine motor skills of a sufferer of a dyspraxic individual. Along with an occupational therapist, a speech and language therapist is also needed if the child has been affected with speech also. The dyspraxia has affected the speech part of the child, and the psychologist, clinical and educational psychologist, both in some cases, and obviously the pediatrician, which can regularly check the child's overall health. Let us jump to how these therapists work, these therapists work in order to make the life of a dyspraxic individual better. First is occupational therapist. The occupational therapist helps a child to do the normal routine task in a different way. The activities which are to be done in routine that are difficult for a child with dyspraxia, these occupational therapists help the child in doing those activities, in making these activities a bit simpler, a bit in a different way, so that, for example, pouring a glass of water from jug to the glass, it is quite difficult for a dyspraxic individual. There is normally spilling of the water. So what an occupational therapist helps is, he will help in training the child in pouring the water or any liquid from jug or from one glass to another glass. So basically it is about making things simpler, learning new things in the way, because it is important for the routine life of a child. Next is language or speech therapist. This therapist is needed if the speech of the child is affected. It includes the exercises with lips, tongue, and all the exercises that are associated with speech. The therapist also takes care of the language part of the child. He focuses on reading and writing skills also. So if the child has these problems with the muscles of the face, the facial muscles are affected, then speech and language therapist is needed. Now, what psychologist? Third is psychologist, an educational psychologist or a clinical psychologist, depending upon the problem of the child. What a psychologist does is, he works on the confidence level of the child. He works on the self-esteem. He takes care of the overall mental health of the child. Because when a child is suffering from the problem like dyspraxia, the chances of being inferior, the feeling inferior, the chances of being compared to other children are very, very high. Because in the normal classrooms, whatever lectures we give, whatever counseling we do with the teachers or the parents, at some points these children are compared to other children too. So it severely affects the mental health of the child. It generates a kind of inferiority complex among these children. So a psychologist works on the stress, the depression, so to prevent the depression, works on the stress. He trains the child with coping skills. and takes care of the overall mental health. Now next is pediatrician. He takes care of overall general health of the child. Other parameters are taken care of along with all the therapies that I mentioned above. So pediatrician also plays a big role in treating dyspraxic children in general. Now what parents and teachers can do in case of dyspraxia? Along with these therapies, the occupational therapy, the speech and language therapy, the psychologist part, the pediatrician part, what parents and teachers can do at home and at school normally with the child. First is use as simple language as you can with the child. Please do not use complicated vocabulary, complicated words. Use simple language in order to give instructions to the child. Most important is repetition. Repetition is the key. Let your child practice a particular skill 50 times if he wishes to, if he wants to, if the condition is like this. Let the child repeat, let the child practice the things for 50 times if he wishes to before mastering the skill. Practice, practice, practice. So practice is the key in these cases, and use same method of instruction every time you teach that particular skill. Use one method of instruction for one particular skill. Do not switch to the other methods. Do not change the methods. Have patience. You need to work hard with these children. So pre-decide what method you are going to use with the training of that particular child. Next is declutter the workplace, declutter the study table, declutter the things around, because more of the things, the more confusion will be there, because there is a problem with coordination, there is a problem with balancing. So a child, will get confused. There are chances of bumping into the things. So it's better to declutter the room, declutter the workplace, declutter the study place of the child. Give extra time for the tasks to these kind of children. These children are poor at balancing, poor at coordination. So obviously these children will need some extra time to complete their tasks. Be aware of the safety of the child. As I already said, they have poor balancing. There are chances of bumping into the things. So please take care of the safety of the child while decluttering your room, while organizing your room, while organizing the classroom, organizing the bedroom or bathroom even. Please take care of the safety of the child. Active play. Please involve your child in indoor or outdoor activities which involve the movement of muscles, the physical muscles, to as much as you can. The more your child is involved in active play, whether it is indoor or it is outdoor, the more the muscles will be strengthened. Involve your child into the activities which he or she is not required to compete with anybody, which he or she can learn at his own pace. For example, gymnastics or individual games. Please do not put your children into those games which require a kind of competition, where he will be compared with other children. For example, team games, basketball, though they are very good for physical exercises, but it may lower the self-esteem of your child. So please take care of that aspect also. Also, many readily available toys in the market are useful. For example, simple puzzles which require kind of orientation, the spatial planning which requires spatial intelligence of the children. For example, puzzles having different shapes, merging puzzles, or other things that are all readily available in the market, which requires some kind of movement, some kind of spatial awareness. These also can be used in case of these children. Motor skills of the children can also be improved with the help of trampolines, riding the bicycle, the rope ladder, these kind of simple or simplest of the activity. Please let your child climb up and climb down the stairs, as many times as you can, because this will strengthen the muscle. This way the child will start learning about the balancing part. So help your child as much as your patience, as much as you can. Please do not hesitate to put your hard work, to put your heart and soul in treating these kind of children. So thank you for your time once again. Please give a thumbs up to the video and do subscribe to the channel if you haven't yet. Bye and have a good day.